Hello and welcome to Tinnitus Matters, the podcast where we discuss all things tinnitus. I'm your host, Phil Holmes.
And I'm Christine Nixon, and today we're very lucky. We've got a really special guest with us, Mr. John de Carpentier, who is an ENT surgeon at Lancashire Teaching Hospitals
Thank you
NHS
very
Trust.
much for taking the time to come and be on our podcast.
Thank you,
Well,
John.
thank you for asking.
So today, John, we're going to talk about the psychological implications of tinnitus, and we're aware that often here tinnitus is thought of as an auditory condition,
Yeah.
but we do know there's psychological implications and emotional responses. Can you explain a little bit about that, please?
Well, it's distressing when it happens because it's an
Mm,
intrusive sound.
Mm.
And especially at the beginning, people get very upset by it, more so if they feel the tinnitus has been caused by something that wasn't their fault. So if it happens spontaneously, which is the
mm,
majority of tinnitus, that's distressing enough. But if you've had some form of injury that you may have lost some hearing or had some damage to your hearing, and then you get tinnitus from that, that tends to make you even more unhappy.
okay.
And being unhappy makes you less able to cope with the tinnitus in a sort of an
Mm.
unpleasant cycle.
So is it an out of control reason you mean when you don't have control of why?
Very much so. You
Yeah.
can't get rid of it. It's there all the time. You
Mm,
can't explain it. And most people immediately think they have a brain tumor. That's their initial response when
Right.
they start
mm,
thinking about it. And when they can be reassured that that's not the case, that a lot of people in a purely clinical context,
mm,
sort of the type we see in the clinic, will calm down a lot.
mm. So with tinnitus, can it create mental health issues and concerns, or do you have a predisposition before it and the tinnitus exacerbates it? What's your experience, John?
Both.
Right.
Um, uh, Both. If you have significant tinnitus that is disturbing your sleep,
Mm,
then you may find you're more likely to develop psychological consequences of it. And then if you have an underlying predisposition to anxiety and depression, then you will find that you are, if you like, predisposed to both perceive the tinnitus as worse and
mm.
habituate more slowly, because
Okay.
and it's the psychological aspects make people habituate more slowly than they otherwise would. And by habituate, I mean get used to it to the point that it
Okay.
doesn't trouble you.
Yes.
Um, because nearly everybody will get used to it, even when they have quite significant tinnitus in the beginning.
Mm,
So you tend to find people have tinnitus that in the beginning might interfere with their sleep and make them sleep deprived, which
mm.
again accentuates any psychological elements that you might be thinking about. And then as they get used to it and they realize it isn't going to do them any harm,
Mm,
they relax a lot more and they sleep better and it helps more. But if you have a predisposition to mental health issues already, then
right.
often that can the opposite cycle can happen, and you become more and more distressed by it, and you find that the tinnitus actually gets worse.
Oh, so it
Um,
feeds it.
so it feeds it,
Mm,
and
mm.
they keep on escalating it until
So
it's
how
even suicidal.
really?
Mm.
How common is that?
Very rare.
Right.
Very rare, um, but it still happens.
Yeah.
You will still occasionally have a patient who has catastrophic tinnitus to the point where they just have, if you like, a almost complete breakdown because of the tinnitus on its own, and they don't sleep at all, and they are completely sleep deprived, and they're in pieces really, and they need some
Oh
sort of
dear.
psychiatric help as well as, or psychological help as well as
So the realities
counseling.
become distorted of the tinnitus,
Very
really.
much so.
Yeah,
It becomes a bigger and bigger thing.
yes, yes. So, and it's a really tricky question. What happens in clinic when there is a patient who is in that case
Well,
suicide?
in that sort of case, then I would be contacting the GP and asking them for a psychological or a
Right. Yeah.
psychiatric
Yes.
referral.
Yeah.
Because rather oddly, in the NHS, as a consultant in an acute trust,
Mm,
I'm not allowed to refer people for a psychiatric assistance, even if I think they need it. The GP has to do that because
wow.
of funding issues with gaining psychiatric help.
Mm,
And you can find people who are suicidal, literally, who I cannot send for help. Um, and we had one patient I remember very well. Interestingly, he was convinced, he was a schizophrenic gentleman, and he was convinced that he had had something done to him in the clinic, and
ah.
actually threatened to kill um, my colleague, who's one of the nicest people in the world, and his team. And I explained to him that everybody listening to him thought that he would be crazy and that he needed some help, and he needed some acute psychiatric help, which he agreed to, but I couldn't refer him. I had to send it back to the GP. And then by the time he reached the GP, he was wild again and he wouldn't take any help.
And that's delaying the treatment and intervention
Very
for
much
that
so.
gentleman,
Very
isn't
much
it?
so.
Which I suppose feeds the tinnitus as well.
Which would feed his tinnitus, yeah.
And that we often hear that tinnitus can trigger, excuse me, John, of the fight or flight response. Can you explain how the body's stress response is involved in the experience of tinnitus?
Well, in the beginning, it's always perceived as a threat. And if
Right.
you have a threat, your amygdala is activated, which is a little bit in the front of your brain that actually is activated more quickly than rational thought. So when you have a fight or flight response or fear, all of that happens without your brain thinking about the implications of what it is or what it might be or what might happen in the future. And then that triggers you tend not to listen to other people or as much as you otherwise would, and you start having all the physiological side effects of fear. So you start, sweating, and you get a raised pulse rate and everything. Which again, you breathe more quickly, you blow off CO2, it makes you more anxious. You have this whole cycle of anxiety,
And then you
making
think
things
something
worse.
else is going on, don't you?
Exactly, and then you
Yeah.
have a panic attack because you feel all these symptoms, and then the panic attack confirms your brain's impression that you're in trouble. And that can happen with tinnitus as well as almost anything else. Not just driving with me in a car, which it also happens.
No comment, John.
Yeah.
So many people with tinnitus, they report difficulties with concentration, sometimes referred to as brain fog, that leads to the cognitive issues. Can you explain why this happens, John?
I find it difficult to be explicit about how this happens because physiologically it should not happen.
Okay.
Because there's no physiological reason why a sound in your brain should interfere with your brain's functioning, but it does occur and it's quite common. And I think it's got something to do with sleep deprivation.
Okay.
And I think that if you are sleep deprived and you are not falling asleep because in a quiet environment the tinnitus is perceived
Louder.
better because you don't have sounds that distract you from it.
Yes.
So it seems louder. That will stop you going to sleep. And then some people find that when they wake up at night, which we all do regularly, people think that they sleep through the night, but if you look at them during sleep studies, it is normal for people to wake up, repeatedly during the night. But if you have tinnitus, you wake up, it's very quiet, you can hear the tinnitus, you start concentrating on the tinnitus, it stops you going back to sleep. Then you say, oh, I'm not sleeping. And what time is it? And then you start worrying about other things, and you end up with that sort of wakening cycle instead of going back to sleep normally.
So when
And
it
then you're
comes to the
just tired.
daytime,
You're chronically
I see.
tired.
So, are there any specific strategies or treatments do you think that can help manage the sleep disturbances associated with tinnitus
I think seeking help early is better
for the tinnitus?
for the tinnitus. And the sooner you can get to see a professional, either preferably an audiologist or an ENT surgeon who can reassure you that this is very common. It occurs in up to 60% of people by the age of 60. And we've all had tinnitus. I mean, anybody who's been to a music concert or will
Yes.
have had tinnitus. And so we've all experienced tinnitus. But to have it prolonged means you start worrying that it might signify something, and as soon as you're reassured that the vast majority of people who have tinnitus, it does not signify anything significant other than the tinnitus itself. I always tell somebody told me a story that I have retold 1,000 times. That tinnitus,
Let this be 1,001.
Indeed, the tinnitus is like being on a bus where something pokes you in the back. And if you might find that a little bit unnerving, but if it happens 4 times in a row, you start to think somebody's looking for a fight, really, and then you're very anxious about it. And you turn around, and if you see it's a blind person with his white stick under his arm, you immediately relax. And the tinnitus is like the blind person with a white stick. It's poking you, but it doesn't necessarily mean that it's an issue you need to be worried about. And as soon as people relax, I think relaxation help, and the knowledge that the vast majority of people will get better at dealing with the tinnitus. You should never say to somebody with tinnitus, you'll get used to it. But you can say to patients, you're more likely to find this less distressing than over time. And then, especially if you have tinnitus counseling or tinnitus rehabilitation or even cognitive behavioral therapy.
So I was going to talk to you about this, John. So what psychological therapies are there? And can you tell me a bit more about cognitive CBT and tinnitus?
Well, CBT is usually only entertained when people have failed counselling or rehabilitation.
Okay.
So they've been on the Tinnitus UK website and they've got some sound generators and they've done all the simple steps that they can do. And then they may have seen an audiologist who's given some advice and further steps they can take to try and essentially relax and not be distressed by it. And if all that is failing, then they can have CBT. And CBT basically tries to repattern your response to the tinnitus.
Okay.
It does not make the tinnitus better. And in fact, it's interesting that all of the publications about the outcomes of CBT and tinnitus suggest it does not improve the tinnitus, but it helps people cope with it much better. So it's repatterning your response to this unpleasant stimulus.
Yeah. Okay. Right. That's interesting, isn't it?
Yeah.
So it needs to be more available.
Well, it should be more available, but it's actually quite hard to get.
Again, funding, I imagine?
Funding issues and people doing it.
So what about things like mindfulness and practices of like that? Can they help?
I think anything that helps you relax is a good thing. And if you respond well to mindfulness, that's a very good strategy to adopt.
Right.
But the first thing is reassurance that it is normal. You know, it's so common that it's probably normal. Everybody will get tinnitus at some time. When you have tinnitus, it doesn't necessarily mean it's going to get worse. It nearly always gets better over time. And the fact is that it may not be the sound that's getting better, but your ability to cope with it is improving.
Right.
So
and the less stressed you are, the better.
So in your clinical experience, it's basically time, isn't it? Talking to the patient, information, explanation. And do you think that's the biggest intervention?
I think that's the best first intervention. And the trouble we've got is sometimes in a very busy NHS clinic, we are looking for tumours. Okay, we're looking for acoustic neuromas, tumours on the balanced nerves of the brain. So we say, well, you've got tinnitus on one side only, so you're going for a brain scan. And if that's okay, we'll discharge you by letter, which is fine for the clinician because they have excluded a pathology that might need treatment, but it's not that good for the patient because the patient has no explanation, no reassurance, nothing that will make them deal with their tinnitus better.
Sorry, as a side, John, with you saying that, I know it's probably difficult to put a figure on it. What percentage of your patients that you do send through for a scan with one-sided tinnitus but have a tumour?
Oh, it's a vanishingly low percentage.
Right,
it's less than 0.5%. In fact, that's probably way too many.
Right. So it's
once a year you might pick up.
Right.
And I see, when I last looked at it, I was seeing 135 patients a week. Wow. So you can work it out.
Wow.
It's very low.
Yes.
So it's very rare. So people that get
very
referred.
Very rare. But there again, if you look at the urgent referral guidelines, tinnitus should go to neurosurgery because tinnitus can be an indicator of a brain tumor. And so under the 2-week rule pathways, at one stage, all tinnitus was being referred to neurosurgery, who can't really deal with it at all. Whereas ENT and audiology are set up to deal with it because it's within our normal pattern of treating patients.
Okay. Interesting.
So what do you think needs to be done to raise awareness about the psychological effects of tinnitus within both the medical community and the general public? Because you mentioned that somebody might get discharged by letter, go home, and they're still
left
worrying.
with it, aren't
Yeah,
they?
they know better. They know they don't have a brain tumour, which to some extent is reassuring.
Must help.
But they don't know that the vast majority of people are going to get better whether you intervene or not. And you can accelerate this getting better over time by very simple interventions such as tinnitus counselling or tinnitus rehabilitation, which are usually done by our audiology colleagues, and they're very effective. The interventions that they have, and taking time to speak to somebody. It's often taking time to speak to somebody that makes all the difference. And whether you're in the clinic or not, that extra minute or two you spend being nice to somebody and explaining to them that, although they are understandably worried about it, it doesn't necessarily mean it's going to get worse. It doesn't mean it's signifying anything bad, and you nearly always will get better over time. That's just those few phrases can make all the difference.
Like we keep saying, Phil, sorry, John, knowledge is power, isn't it? With
Knowledge is
this,
power.
well,
And I
with your
guess
help.
it's how do we get that knowledge out to the general public? Could that be through GPs? Could it be through a podcast
Well, I'm going to say
series?
the podcast is helping, people and their carers.
I think, well, the evidence seems pretty clear that the vast majority of knowledge is currently swinging towards being disseminated via podcasts rather than by the news or via GPs and clinicians and GPs, for instance. They're all rushed off their feet and they have a very short time with the patients. They don't have time to speak to them. And, somebody who has tinnitus, if they looked up the podcast which gave them information, I think that would be very useful.
Can I ask you, John, so are there any exciting developments in tinnitus looking forward that could lead to breakthroughs in addressing the psychological impacts of the condition, or?
On the psychological side, I don't know is the answer. I don't know if there's anything exciting going on.
In any other way, then?
I deal with a lot of tinnitus from a medical legal point of view, where people have been injured and they say they have tinnitus or they don't have tinnitus as well. And that's quite interesting. And there are large undiscovered banks of people who have tinnitus. So, for instance, people who have profound hearing loss will often have hallucinations of music.
Wow.
To the point that they can hear what music it is, and they can, with a bit of concentration, even change the track as they are perceiving it on the record to another part of that same piece of music. And that is an hallucination that occurs in the absence of any stimulation from the ear. And this happens in the profoundly deaf. We don't ask questions about it. If you start asking patients who are very deaf about it, a lot of them have it. And we don't treat them, we don't look at it, and they just hear this music going on.
And isn't it like the very elderly, they have musical tinnitus?
Yeah, they do.
Where they hear hymns or songs from their childhood.
Yeah.
And again, we go, that's okay. And if that's comforting.
You can hear your favorite record, if it's Mozart or Nirvana,
Both are good.
whichever's more comforting.
Yeah.
You will hear that in your head, and you can literally change the track. Fascinating, really.
It's clever, isn't it? The human brain.
Well, the brain is occupying space that would otherwise be filled with sound, and improving people's hearing as well is excellent for tinnitus, because it masks the tinnitus and gives people background sounds or other sounds that their brain can concentrate on. Because a lot of tinnitus is you become focused on the tinnitus rather than hearing other things around you, and that's why it's more noticeable at night.
So, John, as a last thing, if anything could be developed to helping people cope with their tinnitus better, what would you put the money in, let's say, or the work in?
Better masking, I think.
Right.
Better mask, and I understand that the NHS hearing aids all have masking devices inbuilt now, and that's a tremendous step forwards, because if they have tinnitus, they can help.
I can confirm that with mine, and I've got the tinnitus setting.
And do you find it helpful?
What is helpful, sorry to railroad your answer to that question, is the ability to turn it up and down.
That's exactly right.
And so you can change, I think there's 5 different sounds within the hearing aid, but it's
you have control, don't you?
So when it comes up at 2 o'clock in the morning, you can put your hearing aid in, if you like, and just help yourself go back to sleep.
That's a possibility. Do you know what? I've never done that. Maybe I should try.
Well, I had a patient this week. That's the reason it's in the forefront of my mind, who does exactly that. And he has tinnitus intermittently, but quite severely when it comes on. Puts his hearing aid in. He says within half an hour he's fallen asleep again.
Excellent.
Which he didn't used to. Used to keep him awake, and he would cogitate about it and think about it more and more. But musicians.
Yes.
They can expect to have tinnitus because of the sound, especially the ear turned towards the drummer, sadly.
Yes.
Let alone the drummer.
Yeah, yes. So bass players, that would be the
left ear
correct,
in my case.
Yes.
So I have tinnitus on the left, and I have a noise-induced notch. more so on the left than the right.
Really?
Is that from the 18-inch crash symbol?
Exactly.
Yes.
From hearing that symbol all the time.
So do you have a hearing aid, John?
I do not have a hearing aid, but I'm now reaching the point where I'm within 7 years of needing a hearing aid, because 100% of people would probably benefit from a hearing aid by the age of 75.
Right.
Sadly, whether they choose to avail themselves of that
Yeah,
or not,
yeah.
but they, normal noise-induced, normal age-related hearing loss
Mm.
means that by 75, nearly 100% of the population could have a hearing aid.
Well, I'm
Isn't that sad?
definitely they
is.
don't though. But yes,
Yeah.
it's interesting to know that.
And I used to have excellent hearing, and I used to have my hearing tested every year. But when it started dropping a bit with a noise-induced
stopped.
notch, I stopped. I didn't want to know.
Ignorance is bliss, hey?
But my wife tells me I miss her voice.
I'm sure
on
she does.
Is that where the
Yeah.
notch is?
That's where the notch is
Yeah.
specifically.
Selective.
And
Yeah.
bizarrely enough, it's the same for me in my house.
Well, John, it's been an absolute pleasure having you on the show. Thanks so much for joining
We
us.
really do appreciate
I
you
hope-
taking the time, and thank you very much indeed.
Yeah.
Well, it's been a pleasure being here, and I hope I've been able to help a little.
Thanks very much.
Thank you.